Welcome to Baylor University Medical Center. Thank you for your interest in our general surgery training program. We are very proud of our 9 categorical residents that we take a year.
Our graduates are technically skilled, confident, and competent from day one. They leave this institution ready to open up their own practice or embark on whatever fellowship opportunity they see fit.
Baylor University Medical Center in Dallas is the quaternary referral center for the entire Baylor Scott and White system. So we are getting the most complex pathology on every service filtered to our hospital.
A 900-bed hospital here in downtown Dallas, and being in this area makes it a perfect place for a level 1 trauma center, which we are.
We have 57 ICU beds that are surgical critical care beds that we staff. We see a gamut of patients, everything from the trauma patients all the way to heart and lung transplants. We have a very busy ECMO program.
And we get a significant amount of penetrating trauma here, which is something that you don't see at a lot of other places that you're going to go train at. And when you get penetrating trauma, a lot of them will wind up in the intensive care unit. And we get some blunt trauma up there too, but you're going to have very complex trauma patients.
We are one of the busiest transplant hospitals in the nation.
We do approximately 150 liver transplants a year, 250 kidney transplants a year, and between 15 and 20 pancreas transplants a year. And on top of that, we also do 15 to 20 total pancreatectomies a year for chronic pancreatitis.
Colorectal is a very important and vital part of our program. The residents rotate on there 6 months during their 5 years here and get a full breadth of colorectal procedures as well.
We do laparoscopy, robotic, open surgery, redo surgery, anal surgery, colonoscopy, endoscopy of different kinds. We really cover the whole spectrum of colon and rectal surgery.
The vascular surgical service here, it functions completely out of an entirely separate hospital called Baylor Heart and Vascular Hospital. It's attached to the main BUMC hospital, and as residents you rotate as a 2nd year, a 3rd year, and then as a 5th year. We get a lot of autonomy on the vascular surgery service. The attendings really let the chief resident and the fellows kind of run the day-to-day show. Great experience, lots of room for autonomy, lots of room to get good surgical and vascular skills.
Then you'll rotate at John Peter Smith, where you will have exposure to individuals who very often have had little, if no, health care. And that will teach you how to deal with all of the healthcare disparities that are existing in our country.
You really want to go to a program that has a variety of hospitals, partially for the different patient experience you get, but also you just see different ways that attendings, different practices handle the surgery and the medicine and the care of their patients over there.
Baylor Scott and White Waxahachie is a community hospital. It's a great kind of private practice group out there. You do bread and butter general surgery. You really get to see what private practice is like.
This gives a different perspective and a different population of patients to care for, and this widens the exposure of those that may want to go into community practice after their general surgery training.
Even though we do take a fairly large number for any residency, we still are able to provide plenty of cases for all the residents. Most of our residents graduate with somewhere between 1,000 and almost 1,200 cases after their 5 years, so you can plan on operating, not just running around doing busy work, but actually getting to be in the operating room and learn how to operate.
I have been blown away by the amount of cases I've got to partake in and the complexity of some of the cases I've got to assist on. The operative experience has simply far exceeded my expectations.
We have a really good robotic program here. We get very comfortable with the robot, so you get a wide exposure to things simple all the way up to complex.
Getting a certificate for robotic training when you go out, coming from here is not a problem. And I think most of our residents now are starting to graduate with upwards of 50 on the console themselves. So if you want to go into private practice, that's very reasonable to consider.
We have a large research team at Baylor that's made up of a regulatory specialist, of biostatisticians, and of our medical writers who can help with journal manuscript preparation and submission.
We have over 100 members in the faculty. They are split up amongst 9 divisions, and they are all interested in teaching you the most that they can.
One of the best things about this residency program is the relationship residents have with staff attendings.
We are all private practice. We all are committed to resident education. We have a very robust mentorship program.
You report directly as an intern to the attending and start developing this professional and oftentimes friendly relationship.
This is an individual that's well seasoned in general surgery, can help walk you through the ups and downs of training and help give you the direction to have a successful career.
I remember going through the virtual interview process and it being really difficult being in South Carolina to know what it would be like here at Baylor. And all I can really say is that I was pleasantly surprised by the people when I got here. Seeing them virtually, it was good to get a vibe, and I would say it would be even better when I got here of all the people. One thing everyone told me was that they were happy to come to work every day, and that definitely holds true here.
So I chose BUMC because during virtual interviews, I got the impression that all the residents were a very cohesive group, and whenever I got here, I couldn't be happier with the fact that that's true. I've come to learn that from PGY 1s to 5s, everybody has each other's back. We all lift each other up. When somebody's down, we're there to help them, because we know someday when we're down, they'll be there to help us as well.
I think lastly that we get a great operative experience going to the different hospitals, learning different techniques from a bunch of different surgeons. And I think at the end of the day, when you leave this residency, you can leave with friends who are not just your co-residents, but also the attendings you worked with. You can leave with a great skill set to go out and practice, or you've been set up to get a great fellowship.
Education is why we're here. Teaching you to be knowledgeable, to be amazing doctors, and to be technically skilled surgeons is what the Baylor University Medical Center General Surgery Residency is all about.
I think you'll find that there's going to be everything that you're going to desire in a training program, from the breadth of clinical material, the commitment of the teaching staff, and the family atmosphere and the collegiality of both the attendings and the residents in the program.